Hey guys, welcome back to my channel. So today I'm going to continue with the 2 marks pharmacology 3 6 semester question and answers as per RGUHS. So as always I'll say this in the last part, but today I'm going to say in the first part of the video. Please do like, share and subscribe to my channel, and I'll start with the first question, that is differentiate between bronchial asthma and COPD. So the bronchial asthma, it is a condition in which a person's airway becomes inflamed, narrow and swell, which produces extra mucus and makes it difficult to breathe. And where COPD is an umbrella term which is used to describe the progressive lung disease including emphysema and chronic bronchitis, where refractive asthma. So the second is asthma is a common set of chronic disease in the children as well as in the adults. It is increasing by the prevalence or the frequency and the severity, where the COPD is a disease where characterized by a long-term breathing problems and a poor airflow. So question number second or 9, what are the causes of COPD, where the answer is shortness of breath, cough and sputum production. So COPD is induced by the bronchitis, chronic bronchiolitis and emphysema. COPD causes resulting into the narrowing of the alveoli. By question number 10, name the drugs used in the COPD. Number 1, bronchodilators, that is salbutamol, and inhaled glucocorticoids, beclomethasone, and systemic corticoids, hydrocorticoids. And question number 11, that is enlist bronchodilators, where beta 2 agonists such as salbutamol and salmeterol, where formoterol and venitrerol are the examples for bronchodilators, and in that anticholinergics such as epiratropium, tiotropium and thiophelline are the example. So question number 12, what are the leukotriene antagonists? Give example. So it is also known as leukotriene modifiers or leukotriene receptor antagonist, where the medication which functions a leukotriene related enzyme inhibitor or leukotriene receptor antagonist. And the example for leukotriene antagonists are montelukast and zafirlukast. Question number 13, mention mast cell stabilizer, and the answer is the mast cell stabilizing drugs inhibit the release of allergic mediators from the mast cell and are used clinically to prevent from the allergies reactions for the common allergens. And the mast cell stabilizer is derived from the amivisnaga. So the example for mast cell stabilism are sodium chromoglycolate and ketotifen. Question number 14, define expectorant with example. So the expectorant is a medication that helps to bring up the mucus and other materials from the lungs, bronchi and trachea. So example for expectorants are pseudoephedrine, phenylephrine and gaucher ficin. So question number 15, write the uses of expectorants and anti-tissue, where the uses of expectorants are, it is used to clear the mucus from the airways, and it is used in the treatment of common cold, where the bronchitis and influenza etc. are used for the expectorants. So uses of anti-tissue is used to treat the diarrhea and severe pain. It is also used to treat in the asthma, and it is a cough suppressant. Question number 16, what are the difference between expectorants and anti-tissue? So the expectorant is a substance that make it easier to expel the mucus because it makes the mucus less viscous, where anti-tissue is an substance that reduces the coughing reflex from the brain, so you cough less. So the expectorant is not directly impacts to the mucus, but the anti-tissue is directly impact to the mucus. And question number 17, mention 4 anti-tissue agents where alkalis, analgesic agents, opiate, codeine and morphine are the agents of anti-tissue. Question number 18. What are mucolytics? Give example. So mucolytic agents are the drugs which aid in the clearance of mucus from the upper and the lower airways where mucus is made in your lungs. So mucolytics are the medicines that makes the mucus less thick and sticky and easier to cough up. Example, bromhexine, acetylcysteine and carbocystines. Question number 19. What are the adverse effects and uses of bromhexine? And the adverse effect for bromhexine is nausea and vomiting, rashes, diarrhea and pain in the upper part of the stomach. Where the uses of bromhexine, it is an OTC, over the counter medication that is used to treat the chest congestion and cough. So it is also used to breaking the mucus down so that it easier to cough out. And question number 20. What are nasal decongestants? Give example. So the nasal decongestants are a pharmaceutical drug that is used to relieve from the nasal congestion in the upper respiratory tract. And the example, ephedrine, pseudoephedrine and phenylephrine. And question number 21. List the respiratory stimulants where Kafkit, caffeine, dopram, doxapram, NODOS and Vivarin are the examples for respiratory stimulants. So here we have completed the 2 marks of Pharmacology 3 first unit. Tomorrow I am going to continue with the second unit. So please do like, share and subscribe to my channel. Thank you very much.